Hello, I'm Bruce Fawcett. I'm a podiatrist. I've practiced in Raleigh and Chapel Hill area for 25 years. I'd like to take a minute to talk to you about a common foot problem. It's heel spurs or plantar fasciitis. The terms are used interchangeably, even though they're not exactly the same. Most people with heel pain will typically tell you that their foot hurts especially bad with the first step after rest. For instance, you get up after a good night's sleep and you put your foot down on the way to the bathroom or to get your cup of coffee, and you feel like you got to catch yourself. You just about trip or fall because your heel hurts so bad. You'd forgotten that it hurt overnight sleeping, but with that first step it hurts, and generally it hurts very close to where the skeleton shows you on the very bottom of your heel, sometimes a little bit into the arch. What is going on is on the bottom of our foot there is a thick ligament that's gristle-like in its intensity and its thickness. It's much thicker than a simple tendon, and it runs from the ball of the foot to the heel. And when you or I or anyone stands up, that ligament gets spread and it gets pulled too hard, especially pulled too hard on its attachment here on the bottom of the heel. That ligament will have little tears in it, and that's what's meant by plantar fasciitis. Plantar just means bottom of your foot, and fascia just means that ligament, and itis just means it's inflamed. Now, sometimes it gets inflamed so long and so many weeks, months, or years that a little spur will form there. But what most people don't realize is whether there's a spur there or not, the treatment is about the same. The common treatments for plantar fasciitis recommended by authorities everywhere, whether they be podiatrists, physical therapists, physician's assistants, general practitioners, everybody finds good results if you will do gentle stretches, ice, take anti-inflammatories, and most importantly, don't go barefoot. The best shoe for a person with plantar fasciitis is one that has a firm heel counter that grabs the heel, a tie shoe with 5 or 6 eyelets, an athletic style or a leather style walking shoe. Anti-inflammatories, of course, are very good in relatively high doses as long as you don't have stomach problems with them. Other things that are very effective can be over-the-counter semi-rigid inner soles, custom-made orthotics made from an actual mold of the patient's foot, occasional rare cortisone injections, night splints, which are something that helps keep that foot stretched all the time, even when you're sleeping, although some people have trouble sleeping like that. There are even cases where we have to do something called shockwave therapy, and very rarely surgery. Any of these things can be helpful in the treatment of plantar fasciitis, a very common problem since we as humans walk on 2 limbs and often have to walk on hard, unforgiving surfaces like concrete and linoleum. So make sure you wear your shoes, don't go barefoot, but remember stretches, ice, and good shoes. That's the basis of treatment. Thank you.